Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Risperidone. Its brand name is Risperdal. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. The exact mechanism of action for Risperidone, in terms of its antipsychotic effects, is still currently unknown. However, we do know that it has a strong affinity for serotonin 5-HT2 receptors and a slightly weaker affinity for dopamine D2 receptors. It also has moderate affinity for alpha-1 adrenergic receptors, alpha-2 adrenergic receptors, and histamine H1 receptors. Now, in terms of indications for use, we do see Risperidone used in the treatment of bipolar disorder. We can also see it used in schizophrenia. And finally, we can also see Risperidone used to treat the irritability associated with autistic disorders. Now, before somebody was to use Risperidone or Risperdal, there is a contraindication, which in this case would just be a hypersensitivity to Risperidone or paliperidone or any other component of the product. As well, there are some precautions and warnings that patients should be made aware of. So in terms of precautions, Risperidone is on the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. We would want to avoid using Risperidone in the elderly population to treat things like delirium and dementia. This is mainly because it could increase their risk of experiencing a cerebrovascular accident, and their mortality would increase as well. We would also want to avoid using this medication in patients with Parkinson's disease, as it would increase their risk of falls, therefore increase their risk of fractures. We would want to use this medication cautiously in patients who have cardiovascular or cerebrovascular disease, as it would increase their risk of orthostatic hypotension. We would want to use this medication cautiously as well in patients who have diabetes mellitus or in patients who have risk factors for diabetes mellitus, such as a family history or obesity. This is mainly due to the fact that these patients may put themselves at an increased risk of having a lack of control of their glucose levels, and they could also experience severe hyperglycemia. Hyperprolactinemia may occur in patients using Risperidone, and this could lead to galactorrhea, amenorrhea, or gynecomastia. Dyslipidemias, as well as weight gain, which are things that could increase patients' risks for cerebrovascular or cardiovascular events, have been reported with the use of Risperidone. Patients should use Risperidone cautiously if they're performing activities that may increase their core body temperature, as the use of antipsychotics in general may decrease patients' ability to control their core body temperature. Hyperthermia as well as hypothermia have both been reported with the use of Risperidone, so it would be important that patients who are going to be exposing themselves to extreme temperatures use this medication cautiously. The use of this medication could result in esophageal dysmotility, which in some cases could result in aspiration and lead to aspiration pneumonia. Granulocytosis, leukopenia, as well as neutropenia have all been reported with the use of Risperidone. Patients who use this medication who have hepatic impairment may be putting themselves at an increased risk of experiencing orthostatic hypotension, which for those who don't know is just a drop in blood pressure when going from a seated to a standing position. Potentially irreversible tardive dyskinesias have been reported. Patients would be at an increased risk of experiencing these if they were using higher cumulative doses. Patients should be made aware that neuroleptic malignant syndrome is associated with the use of antipsychotics. This medication should be used cautiously in patients who have a history of seizures or in patients who are using other medications that can lower the seizure threshold. And finally, Risperidone should be used cautiously in patients who have renal impairment, as there has been an increase in Risperidone levels in patients who have severe impairment, severe renal impairment that is, so creatinine clearance less than 30 mils per min. Now, once somebody is cleared of that contraindication and made aware of the precautions and warnings, and they start to use Risperidone or Risperdal, they can expect to receive their dose orally, or they can receive an intramuscular injection. When somebody is using the intramuscular injection of Risperidone to treat bipolar disorder, they would typically use 25 milligrams every 2 weeks. Again, this dose would be received through an intramuscular injection. Oral doses of Risperidone would typically be on board during the initiation of therapy, continued for about 3 weeks, and then discontinued, and then you would just let the Risperidone injection do its job. The maintenance dose can be increased to 37.5 milligrams or 50 milligrams, again every 2 weeks if needed. If an individual is using oral risperidone to treat their bipolar, they would typically start off with an initial dose of either 2 or 3 milligrams once daily. Dosage adjustments can be made by 1 milligram per day in intervals of at least 24 hours. And doses above 6 milligrams daily have not really been studied in clinical trials. If somebody is using the intramuscular injection to treat their schizophrenia, the dosing seems to be the same as it would be in bipolar. However, if somebody is using oral risperidone to treat schizophrenia, then the dosing is a little bit different than in bipolar. They can start off with an initial dose of 2 milligrams, which can be given once or twice daily, and then doses can be increased by 1 or 2 milligrams every 24 hours. And the usual maintenance dose is about 2 to 8 milligrams daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using risperidone or Risperdal, so I'll go over some of those here now. 1 to 4% of patients may experience a rash while using this medication. Hyperprolactinemia is common in pediatric patients. 8 to 21% of patients may experience constipation, and other patients may experience an increase in weight. Up to 8% of patients may experience diarrhea. 1 to 10% of patients using the oral therapy may experience an excess in salivation. Increase in appetite, indigestion, and nausea have been reported. Some patients experience upper abdominal pain, and about 10 to 25% of patients may experience vomiting. Dizziness can happen between 6 and 16% of the time. Parkinsonism has been reported between 6 and 28% of the time. Anywhere from 5 all the way up to 63% of patients may feel sedated. Up to 16% of patients using the oral risperidone may experience anxiety. Nasal congestion, as well as a pain in the throat, have both been reported. And blurred vision has been reported as well. The more serious side effects would be a prolonged QT interval on an ECG, thrombocytopenia, the development of a pulmonary embolism, diabetic ketoacidosis, and finally hypothermia. That's all we're going to talk about today with risperidone or Risperdal. As always, I'm very thankful you took the time to come by and watch one of my videos. If you did find the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.